everyone, and welcome to the Surgical Ergonomics podcast, where we will be discussing everything related to surgical and procedural ergonomics, the people, ideas, and technology that will help enhance your physical wellness and career longevity. I am your host, Geeta Lal. I'm an academic endocrine surgeon, speaker, consultant, and surgical ergonomics coach. Having experienced work-related musculoskeletal injury myself, I am committed to increasing awareness of and developing solutions to counteract the impact of poor ergonomics on the professional and personal lives of healthcare workers in procedural areas. Today's episode is sponsored by Q Optics. Surgeons, your neck shouldn't pay the price for precision. It's time to demand loupes that are built for you. Q Optics is more than magnification. Custom crafted through the lens loupes engineered and tailored to your unique facial structure and surgical posture. The ultra lightweight titanium build eliminates pressure points, red marks, and the chronic neck and shoulder pain caused by heavy, bulky, outdated optics. With the exclusive TrueFit measurement system, each pair is precisely tailored to your unique facial structure, delivering a customized stress-free fit and all-day comfort. The Ergo Direct Vision loupes with up to 60 degrees of declination keep neck flexion under 15 degrees, or go zero flexion with the Ergo Angle Deflection loupes for a straight-ahead gaze and complete ergonomic relief. And with crisp, edge-to-edge clarity within an expansive peripheral view around the telescopes, your field stays wide and unobstructed. Transform your OR experience today with a 45-day trial and exclusive pricing for listeners of this podcast. Visit qoptics.com/Dr. Lal to learn more and schedule your demo with a local representative. And again, don't forget to use the code Dr. Lal to claim your discount. Your work demands precision. Your body deserves relief. Q Optics, designed for comfort, built for performance. By the way, Q Optics has also provided us with an Ergo Angle Deflection loupes and headlight combo giveaway. The details will be provided at the end of this episode, so stay tuned. Hello, everyone, and welcome to another episode of the Surgical Ergonomics podcast. In today's episode, I'm delighted to have as our guest Dr. Donnie Saw. Dr. Saw is a professor and chief of pediatric ophthalmology and the Eye Mobile program at the University of California in Irvine. He works at the UCI Gavin Herbert Eye Institute and the Children's Hospital of Orange County. He volunteers with Orbis Global Health Programs, providing medical care and training ophthalmologists in underserved areas across South America, Europe, Asia, and Africa. In addition to all of these things, he is also the chair of the American Academy of Pediatric Ophthalmology Section Membership Committee. He's an inductee of the American Ophthalmologic Society and was awarded the Inventor of the Year Award in 2019 by the University of Nebraska Medical Center. Hello, Dr. Saw, and welcome to the Surgical Ergonomics podcast.
Thank you, Geeta.
My pleasure. So glad to have you here. Dr. Saw, in just getting started, I would like it if you could tell our listeners a little bit about yourself, particularly about where you grew up and your training background and how you arrived at your current roles.
Yes, so I was, I was born in Korea and I moved here when I was 13 through just amazing people and exposures to a lot of inspirational figures in my life. And I went into the field of ophthalmology, and I feel blessed. As someone who's the first physician in the family, I really did not know what to expect. And so, I've learned a lot since then because I've now practiced for about 25 years. So I finished my training and fellowship about 25 years ago, and it's been just an amazing and wonderful journey.
Awesome. I think we have that part in common. I mean, I moved to North America when I was 17. So, when you come at that sort of age, you're kind of influenced by, as you said, a lot of great people that you work with, get a chance to see, maybe you volunteer with them. So glad to hear that. So, given all these things, how did you become interested in ergonomics for surgeons?
Yeah, so when I first went into my field of ophthalmology, I
Hmm.
really did not know much. So I was just kind of learning as we go. Even just a medical knowledge that we had to master
Hmm.
was it can be somewhat daunting. And then, taking care of patients, the art of science, art of taking care of the children, the parents. I think it was all very, very challenging in so many ways. So at first, I'm going to say for the first 5 years or so, I was very focused on ophthalmology. And then for the next, I'm going to say 10 years, for, basically this will be 15 years after practice, I was, focused on things that's outside of ophthalmology. For example, I think I focused on leadership style, how to interact with colleagues, how to interact with administrations. So I got, and then also I got interested in a lot of inventions because I felt like we could do better with some of the equipment that was available. So that's kind of like what I focused on. So, but after about 15 years of just being submerged in my field, I started having discomfort, a significant discomfort. And I started looking at my colleagues around the country. And then I realized that many of them had issues with the musculoskeletal disease and they were retiring very early
Hmm.
at a very early age. So that was something that was concerning. And also, second, as I was looking around and looking at my colleagues and looking at their posture, like when I go to the national convention, and I
Hmm.
was just, it was just something that I just would ignore before. So I would look at their posture and it just looked very unnatural and it just looked very, very unhealthy. And then I started videotaping my own posture because I wanted to see, because there's just no way that you can see yourself. I started videotaping my postures and I realized, oh my goodness, this is something that had been overlooked all my life
Hmm.
and throughout my career. This is something that I need to address. I was having significant discomfort and pain on a
Hmm.
daily basis.
Okay, thank you so much for being open and for sharing that.
Hmm.
So, Dr. Sa, I want our listeners to realize that this is such a common theme. If people are just tuning into this podcast for the first time and looking at your episode or listening to your episode, I want them to realize that musculoskeletal injuries among surgeons are very common. We discuss this in almost every episode. It doesn't matter which field they're in. And a second theme is that, necessity is often, the mother of invention. You mentioned that you were starting to read about this in the literature. You were experiencing pain and symptoms yourself, and then you started to notice your colleagues' postures. And I commend you for recording yourself and taking a look because that's exactly it, right? We are so busy taking care of the patient and their needs and the team's needs that we are often relegating our symptoms to the back, right? That's part of surgical culture. So all of these are very common themes. And so I just want our listeners to realize that. The other thing I want them to realize is that, as I was looking at the literature, I realized that Dr. Saw has actually written about this high rate of work-related MSK symptoms among ophthalmologists and specifically pediatric ophthalmologists. He's also an expert when it comes to kind of the implications of using surgical loupes. And if you look at some studies, both objective and sort of subjective data, there is now good evidence to show that the use of loupes during surgery is actually an independent risk factor for the development of work-related musculoskeletal injuries. So I'm going to pick your brain a little bit, doctor. So why are loupes such an ergonomic risk for the surgeons who use
Oh,
them?
sure, sure. Thank you very much. You bring up so many important topics that I mean I could extrapolate on for hours, but I'm
Yeah.
going to just stay focused on your questions. So surgical loops was developed in 1876. So we're talking over 100 years ago. These surgical loops were developed because we surgeons were doing surgeries that were getting on a surgical field that was getting smaller and smaller. And with our limitations of what we can see optically, we needed that magnification. And so there are two types of surgical loupes
Mm,
in terms of the telescope. So all surgical loupes are just simple telescope that
mm-hmm,
brings the image from far away to close so that we can see things more clearly and see the details. That's it. And so there's nothing magical about these loupes, and there are two types of surgical loupes.
mm-hmm,
The first style is called Galilean telescopes. So these Galilean telescopes have two loupes, one convex and one concave. And the second one is called the Keplerian. So there are three convex lenses that are placed next to each other. And so the Keplerian is very heavy.
mm-hmm, mm-hmm.
It has three lenses.
Right.
So people don't really use capillarian too often, except for like a microvascular surgeons or heart surgeons. They
Mm,
use those. So most of us use a Galilean telescope. But either way, when these telescopes were invented, you
mm-hmm.
remember there were glasses. They didn't
Right.
have
Right.
plastics back then. So they were using glasses. So when they were putting these telescopes, they had no choice but to place it perpendicular to the lens. So
Right.
it was going straight out from the plane of the glasses. It was being placed perpendicular to it.
Mm.
So that what you have to do is that you have to bend your neck and your back to
Ah.
see the surgical field because we don't have the body placed at our eye level. We place them on a table. So you have no choice but to bend your back about you bend your back about 20 degrees and then
Mm-hmm.
you bend your neck
Neck.
about 20 degrees to compensate for that 40 degree of that angle. So
Mm-hmm.
that 40 degree has to come from somewhere. So
Mm-hmm. Mm-hmm.
and half of it is from the neck and half of it is from the back. And so that's why it's an independent risk factor. So that's the reason
Mm-hmm.
many of the dentists,
Mm-hmm.
many of like yourself, endocrine surgeons, and a lot of these surgeons who are using surgical loupes, they have no choice. And they were starting to have neck and back pain.
Mm-hmm.
And of course, the surgical loupes were being modified. And we could talk about the changes that these industries are making to make
Mm-hmm.
things better. But these glasses were basically no changes were made for almost over 100
100
years,
years. Yeah.
over 100 years. And so we were using something that's very unnatural for the body,
Mm-hmm.
meaning it was not ergonomic.
Got it. Well, thank you so much for explaining that. I'm trying to think back at like maybe like you said, before kind of the first loops came on the market, and I'm guessing, and please correct me if I'm wrong, I'm just had this vision of like surgeons and somebody's holding a magnifying glass in front of them, if they really wanted magnification, or they kind of have some, mechanical arm or something holding magnification. Then somebody comes up with this bright idea to use lenses made of glass, as you said, getting a telescope on a pair of glasses that the surgeon can wear. But that angle of insertion of the telescope into the glass, as you said initially, was perpendicular. And as the loupes kind of kept being used, that angle of declination was still pretty, like you said, maybe 40, 50 degrees, right?
Mhm.
And because of that, then we had to compensate to be able to see the field, which is our patient on the table, by flexing our neck and flexing our back, right? And keeping these uh, postures static for a very long time. So one, they are non-neutral, and then depending on the case, we are doing it for a long period of time, right?
That's right.
Okay, so now you brought this up, so I would love it if you could expand on this. So, what happened over these 100 and let's say 150 years? What were the changes in the loops, and why haven't things gotten all that much better, maybe until very recently? Because I got my loops, let's say in 2002, so 23 years ago as a fellow, and we still had the same design. We had these lenses, telescopes, and I was using 2.5, and I think as you said, if you get 3.5, 4.5, you're using more lenses, right? Why didn't things change until more recently? So if you could just kind of expand on that history,
Oh,
that
sure,
would
sure,
be, I
sure.
think, I think our listeners would love to hear this.
Yeah, yeah. So, as you know, Gita, I'm an inventor, so I love inventing things. The problem with the surgical loops is that the denominator, the people who are using it, is actually fairly small in number.
Oh,
Uh,
really?
yeah,
Okay.
yeah, yeah, yeah. Remember, if you look at the population on Earth, think about how many people actually use surgical loops. I mean,
Okay,
you're
true.
talking, it's a very, very small number. And on top of that, they buy it regardless. Like you have, it's not like you have choices because you don't have a lot of denominators, or like you don't have large group of people. There wasn't a lot of competition.
Mm,
So remember, competition breeds innovation, and innovations breeds improvement. But I truly think that if you think about this industry, for the longest time, it was not, I want to say monopolized, but it was only a very small group of people,
right.
companies that were making these glasses. Because if you look at all the surgeons, if you go to the operating room, Gita, I
Mhm.
could tell you most of those surgical loops were made by two companies. And so I think
A
that
small number of players, like you said. Yeah.
yeah, it was a very small. And so I think that the denominator, the people that were using it, was very, very small.
Mhm.
And then number two, there wasn't a lot of competition. And I think that was another thing. And then number three, the materials. The technology has improved a lot because the frames were made out of either steel or it was made out of plastic. But the titanium came along. So that really changed everything too. So
Right.
different materials that were invented later, and also prism deflections. That was something that we have been working on for a long, long time, and that actually got improved much more recently as well. So within last, I want to say 4 years, things really have changed in a positive direction.
Okay. That makes sense. Actually, you're right. I remember when I was looking for loops, there weren't many company options out there. Okay. And we'll be back right after the short break. Surgeons and proceduralist colleagues, we trained for years to master what we do, but most of us are never taught how to protect our bodies while doing our jobs. Neck pain, shoulder fatigue, back stiffness after long cases. For many of us, this isn't the exception, it's routine. That's why, starting on February 16th, 2026, I'm launching the first cohort of a virtual hybrid coaching program in surgical and procedural ergonomics, designed for clinicians who want to perform at a high level without sacrificing physical health or career longevity. The program includes 2 small group sessions plus 2 individualized one-on-one coaching sessions using PoseChecker, which is an AI-based motion capture system that provides personalized, actionable ergonomic insights both inside and outside the OR. I'm Geeta Lal, an endocrine surgeon with over 2 decades in the operating room and first-hand experience with the pain that comes from operating. I'm joined in this endeavor by Linda Miller, an occupational therapist and certified professional ergonomist, and together we bring real-world OR-tested solutions to you. If you're ready to invest in your performance and your longevity, email me at geeta@surgicalergonomics.com to get details and register. Your body is not disposable. Your career shouldn't be either. So now, what is the difference between these newer prism loops, right, as you said, compared to the traditional Galilean loops that we talked about a few minutes
Mhm.
ago?
Oh yeah,
What
yeah.
was the improvement?
I'm gonna just tell you, there are actually many. So I'm gonna just, Geeta, this is actually my area of expertise,
I
and
know,
I,
that's
I
why we're
could, I
talking
could.
here.
Number one, you talked about this before, the declination angle. So you could, instead of having these lenses come at it like a perpendicular, they
Mhm.
could tilt it. But the problem is that there's so much that you could tilt, because if you continue to tilt and tilt and tilt, then it causes a image blur. And also your eyelid, like as you're looking down, your eyelid pushes on the cornea and can actually distort the curvature of the cornea and cause astigmatism. Number one. Number two, it will in combination of indentation of the cornea along with the dry eyes, that will blur your vision, not even just looking down, but like when you try to look up, you're still blurred. So you have
Oh,
continuous blurred vision. And that's why when you work for long periods of time and you try to look away and trying to look at the clock and you can't see it. And that's the part of the problem. So there's so much declination angle that you can acquire to the regular loops. But later, instead of glasses, we started using plastics, like specifically polycarbonate lenses. These are basically plastic that are very tough, like the glasses that you have right now. So
mhm.
they were able to replace the glasses with a modified plastic material, and then they were bending the curvature of the lens. So that actually helped with the declination angle. So when you bend the front surface of the lens and increasing the curvature, then you can add the Galilean telescopes more at an angle to begin with, so you don't have to declinate as much. So
Got it.
number one, so that was a huge change. Number two, the frames have changed. These frames were very heavy. I don't know if you remember. If you hold your old loupes, you will see they're very heavy, and your
Mm.
nose is carrying 90% of that weight. Your poor nose, as you know, I mean, this is not a hard bone. Some of it is cartilage, some of it is like a connective tissues. And so the nose is bearing a lot of that weight, and most of the weight is placed in the front. So it's a
Mhm,
completely unbalanced device that we're putting on our face. So
mhm,
already you're tilting your body forward, and on top of that, the heaviest part of your body, which is your head in your skull, you're putting a heavy object front of it. And so you're tilting it even more. And so that causes more pressure on your neck because you're trying to counterbalance. The current frames are much lighter now. So you're not putting so much weight on the front of the face. So that's next. And then next is that so the frame is much lighter and it's more balanced. These lenses are also, instead of glass, it's a plastic, so it's much lighter. So I think that has actually changed significantly. And also the strap. Like Gita, when you were doing surgery 20 years ago, do you remember the strap that you had, the cloth black material?
Yep.
Well,
Yeah.
that material is extremely dirty and contaminated. Most surgeons who have been practicing for 20 years, they never wash that cloth.
I
I've
think
never
you're
washed.
right. I'm guilty of the same. I
And
never did.
so I actually did an experiment and I didn't even
Oh
touch.
no.
Yeah, I did an experiment. I didn't even touch the blood auger. I basically placed a strap right over the blood auger. I gently just tapped it just a couple of times,
Oh my goodness.
and the culture came back positive. It was completely unacceptable. And I
Wow.
truly think that this is one of the reasons why there's a potential contaminations and infections after surgery.
Hmm.
So, because remember, you have these straps right over the surgical field. And
Hmm.
when your head is moving, these
Yeah.
things, some of the bacteria can fall. So anyway, so now the strap, we developed this special strap that's made out of a polyethylene material, and it has an antimicrobial properties. And it actually straps very comfortably around your occiput of your head so that it doesn't even touch your ears. So these frames, a lot of times that if you have them fitted properly, it doesn't touch your ears, and it barely it touches your nose. So it's very comfortable. And then on top of that, lastly, I want to say is that prism deflection lenses. So now we have these lenses that are bent, and we call it prism deflection lenses. And so by taking advantage of these special prisms, you can sit up completely because you're deflecting the light. So you can actually look straight ahead while you're looking at the surgical field without putting any strain on your back or your neck. So
Right. I
that's
think
that's a really like a simple synopsis of what's happening.
Well, I'm very grateful to you for sharing that because I think a lot of people will find it very useful. I would say that in addition to all the things that you've said, there are a couple of other things I've noticed myself and other surgeons, right? Because loupes are so expensive, right? And usually programs buy them or we buy them. And, as surgeons, we're hesitant to get newer and newer loupes because even if kind of our eyesight might change a little bit, because as long as the magnifying part works, most of us will continue to work on them. And then all these features that you mentioned, people don't get a chance to take advantage of, the light lenses, the light frames, and all these newer sort of, prism and deflective lenses and the newer technology. But for people who are starting to kind of look at this technology, I imagine that the terminology gets very complex. And so I appreciate you sharing with us, what actually happened and what changed. I do want to clarify something though, because if I'm having this question, I guess other people might have this question. I've seen some loupes advertised as prism loupes versus others as deflection loupes. The ones that are like the 90 degrees are called deflection. Is it one and the same, or are they actually different? Like, can you have prism lenses in kind of a Galilean loupe, or they're one and the same?
So no, no. Actually, I want to touch on what you said before, and then I'm going to answer this question because this is so important. So for children, it is said that 80% of their development hinges on good vision.
Mm,
For surgeons, I want to say is not much different. Vision, of course, our tactile sensation is extremely important. Of course, hearing is important. Of course, we use all of our five senses. But the vision, it starts with the vision. So the vision is extremely critical for surgeons. I'm going to say that yes, these lenses are expensive, but if you look at tennis players, golfers, they save some money on their shoes or anything like that. But the actual sports equipment, like if you're a tennis player, the racket, if you're a golfer, the driver, the putter, you don't go cheap on those. And for surgeons, I really think that this is extremely important, because it really starts with the vision. And second of all, two things I want to say is that I think the price actually has gone down over time because I actually been watching and
mhm,
they are dropping because of more and more people are using it. Like it's all about supply and demand. If you have more people demanding it, the price drops because it's cheaper to produce.
mhm,
Number one. Number two, these residents that are in training, I'll highly recommend many of the programs, most of these companies, they want to get these residents or fellows be introduced to these special loops early. So they have a significant discount, and I would highly recommend that they take advantage of that. So I have no financial interest, by the way, okay? And then back to your question.
What is the actual difference
Oh yeah,
between
yes, yes.
prism
So
versus
yeah,
deflection?
yeah. So, it's all in the terminology, but there are different types of prism surgical loops. Gita, I'm going to just say that they're similar. They're very, very similar, but the prism deflection loops are subtype of the prism glasses or prism surgical loops. But there are different types of surgical loops, but most of the prism deflection loops are somewhat similar now. I think they're becoming more standardized. So other forms of prism corrections for surgical loops is gradually disappearing because it's too cumbersome and too heavy. And
Got it.
also it reduces the quality of the image.
Got it. Okay. So for practical purposes, listeners, when we're talking about prism deflection loupes, we mean the loupes that you're seeing on the market now that look like you have a microscope in front of you on your glasses because they're angled at 90
Mhm.
degrees. So basically, you're going to be looking forward and be able to see the field, which is the patient and which is perpendicular to you. And just like, Dr. Saul mentioned, almost all the loupes companies that you will look at now, they actually have a version of this prismatic deflection type of loupes that we're talking about. And I know that, I trained in Canada, okay? And so I had to purchase my own loupes as a fellow when I decided I was going to do endocrine surgery as a career. When most of I think I see our trainees here in the US get them through their residency program. Obviously, it varies, but a lot of residency programs will pay for them. I've been fortunate that I've actually switched to these deflection loupes, and I noticed a difference because when I'm not wearing loupes, and I gave up wearing loupes, to be completely honest, around 2017 when my pain was really bad. The neck and TMJ pain from that sustained forward head exaggerated posture, as you mentioned. I completely stopped wearing loupes. And when I started wearing these deflection loupes selectively, not for every case, I noticed that it was actually even better than when I was doing open surgery because I was actually able to keep my neck relatively straight. And the only thing that happens is I think our scrub tech or the residents get a little freaked out because it looks like I'm looking at them, but I'm actually looking at the field. They feel like I'm looking straight at them. And I have to add something about your innovation. Okay, so I tried this strap that you're talking about for two reasons. Once the reps explained to me what the strap you mentioned was about, I realized two things. I said, well, one, yes, I always had a dent in my nose because, well, I have no nose bridge. Everyone in my family has Grecian noses from North India, and I have no nose bridge. So you're right, the weight sat squarely on my nose. And despite multiple changes and fits, I would always have pain near the ears, right? Because the loupes were not sitting well. And I did try your strap or the ones that you designed. I actually felt that for the first time ever when I was wearing loupes, I didn't feel the weight even after a 4-hour case. When I took them off, there were no dents on my nose. So I appreciate the time and the effort that you put in to thinking about these things and, designing these specific straps. So for anyone who's looking at different loupes, remember to kind of not just look at the angles of declination and the lenses and the magnification, but check out the frames, check out what kind of lenses are being used, and check out the straps, right? So this kind of brings me to, by the way, the strap that Dr. Suh mentioned it's actually called the Suh Hermsen head strap. And I think you hold a patent for it, right? It was developed when you were at the University of Nebraska, or was it with the University of
Yes. No,
Nebraska?
no, it was developed when I was at the University of Nebraska.
Okay, all right. So for listeners who want to read about it, I'll enclose the paper, etc. What I wanted to pick your brain a little bit more now is just an extension of what we were talking about. So when residents and people are getting fitted for loupes, even junior faculty, right? Like we've taken some time out, we're sitting in a conference room, we're putting our fingers in front of us, and the reps are helping us kind of and taking some measurements, right? In all the years that you've watched people using loupes and all the research you've done and all the work you've done, making kind of our loupes experience better, do you have any best practices that you can share that people should think about when they are looking to purchase loupes? Like, should the reps be actually coming into the OR and watching you and taking video and then kind of helping you figure out what loupes? Should you have your senior partner there to see how you're operating? I'm just sort of thinking to
Mm.
my experience and hoping how we could make it better.
Oh, thank you, Kita. That's excellent question. First of all, yes, it's a must. So for prism deflection loop, it truly has to be customized because if it's even slightly off, you're not going to be able to use it because the pupillary distance. So when you're looking through your glasses right now, looking at me, Kita, you don't have to look through the optical center. You can look a little bit slightly left and slightly right, up or down, because the your lenses actually have a pretty wide area of focal points, but these loupes are very specific. So you have to look through that optical center of that loupes of that prisms. It's even more important because remember, you're not just looking straight, you're looking through the prisms.
Right.
So if you're just slightly off by, we're talking half a millimeter,
Oh,
it's going to
wow.
be blurred. It will be blurred. So first of all, number one, the rep has to be there and measure you carefully, number one. And also, they don't just measure your pupillary distance, but also they have to measure your working distance very, very carefully.
Mm,
Because depending on where your working distance is, they will change your focal point. And also they will need to change the magnification of your glasses too. Ideally, it'd be nice if they could go into the operating room and just watch you or observe you. But usually that situation doesn't arise very often because we do not allow visitors to come into the operating room very often. So what I would recommend is that try to simulate the operating room situation in your office. So have some like, 3D printed devices or like any type of specimens that you could use
mhm,
to simulate your surgical experience and have them watch you and measure you carefully. So I think
mm,
that's extremely important. So it truly has to be customized to your face and to your working distance. And hopefully you'll be as closest as possible to the real live situation of your surgical field. Number one. Number two, for example, I'm going to talk about golf because I'm a golfer. So we change golf clubs like most golfers change some of my friends change it every year. Some of us change every like few years, but you really have to change it like, once every 10 years. You have to. The reason for that is that your posture, your body changes. So once you get these glasses as a fellow, I'm going to tell you, Gita, I'm really really sad to see this, and I was guilty of this too. After 20 years, I was using the same loops that I had when I was a fellow. Even though I have gotten shorter, my body has changed. My working distance has changed, and so you have to customize these loops according to your body habitus. So you have to upgrade it. I'm going to highly recommend every 10 years. And this is a must. This is truly a must. And I recommend it to everyone, to my
okay.
colleagues. And I see people all the time. Like they have the same loops that they had like when they come out of training, and they have the same dirty strap that they have on. They've never washed. I cringe. I cringe whenever I see this.
Yeah, so thank you for sharing that because that advice is gold. And now I'm going to pick your brain a little bit more because we have still a few minutes, and I really want to get this information out to our listeners. So when I'm giving talks on surgical ergonomics, we briefly touch on the topic of loupes. I do talk about the deflection loupes, and I say, it's particularly you can't use those if you're working in the perineum, but if you're working in the neck or abdomen, things like that, certainly try out deflection loupes because as we said, research has shown that it helps kind of keep your neck aligned in a more neutral posture and perhaps reduce the risk of future work-related musculoskeletal symptoms. We'll have to see because the loupes haven't been around for that long. But the most common sort of kind of criticism I get for these loupes is some people will say, yes, I noticed these, I tried these, but I just couldn't get used to them. I felt so nauseated. It was just really hard to adjust to. And I understand that because I realized that there were two key differences. I did have a little bit of nausea the first day, but mine passed very quickly. And I think it was because I had a very long washout period, right? I had not used standard loupes for a few years before I tried deflection loupes. So it's not like my brain suddenly had to switch looking from traditional Galilean loupes to these loupes. The second thing is, I think, as we mentioned, because of this deflection or right angle, the loupes actually, the telescope sits a little bit higher, right, in the glasses compared to the Galilean loupes. And so if you want to look at the clock or the rest of the field, it's not a simple matter of just elevating your eyes and your eyelids. You actually have to be able to look from the lower part of the lens. And that takes a bit of getting used to. And we know the optic center in the brain probably needs some time. So This was just my observation. Sometimes I tell people, you know what, try not using any loupes for a couple of weeks and then try your deflection loupes and see if that helps. So I want to know, am I barking up the wrong tree? Do you have any other advice, or am I thinking through this the right way?
First of all, changes are the most difficult thing that human do. As you know, as we get older, as we get settled in our own way, it is difficult to change
Yeah.
because we all develop these blind spots, and these blind spots become permanent. So
Hmm.
if you don't see it, he's not there. And it's like it's hard for us to change that concept and understand that you have a blind spot. And so I think first they have to want to change. If there's no desire, there's nothing you could do, Gita. Let me just start with that. Number one, I mean, I wish that I could inspire these young doctors and talk about ergonomics, but right now they have so many things on their mind. They don't have the luxury of not wearing glasses for a month. They don't.
Right.
They are operating every day.
Exactly.
So this washout period, Kita, it doesn't exist in a young
Okay.
people. Okay,
Okay.
so let me just say that. Okay, okay.
It's just our life, right?
Yeah,
Yeah.
yeah. So these are some of the problems of the prism deflection lenses that you have to understand before you get into it. It's like you have to know the pH and the depth of the swimming pool before you jump in.
Hmm.
So I'm just going to tell you what the swimming pool feels like. So number one, because there's a prisms by design, there's a significant image displacement. Please remember I said this term, image displacement. So what I mean by this is that when you're working within the visual field of the surgical loop, so you're working here, but then once you move your eye to the left or right, go outside of that visual field, there's going to be huge displacement. So that's very alarming for people. So,
Hmm.
like when you're working here and then you look to the side and suddenly your hands are like over here. That image displacement is something you have to get used to. So, like for example, like if you're asking for an instrument and you're putting your hand out, in your mind, your hand, even though in reality, hand is over here, but your brain thinks that your hand is over here. So
Hmm.
there's a disconnect of the image
Hmm.
displacement. And I can actually show you the diagram and see and tell you exactly how much the images are displaced based on the amount of prisms. Number one. Number two, when you have these prism glasses, you lose some of the visual field. So
Hmm.
with the traditional loupes, you have a visual field of certain degrees,
Hmm.
but with these prisms, because you cannot bend every single light in the same direction, it is constricted. So your visual field from here, now you're going to this smaller area. That
Hmm.
is something that you have to get used to.
I
So if
see.
you're working in an area, like for example, abdomen, it may not be ideal. These surgical field, these prism loops may not be ideal because you're working in a large area, and then
Hmm.
that means that you have to tilt your head and you have to turn your head looking in different directions. That just would not be feasible. So this is an ideal. These loops will be ideal. Like for example, ear, nose, and throat, or if you're
Hmm.
working specific areas of plastics, or if you're looking at specific organ, I think it's more conducive for that type of surgery when you're working in a smaller area.
I see.
Okay. And then the one last thing that I want to say is that unless there's a need, people will not want to change. I think you have to talk to the right people.
Hmm.
You have to you just have to either they have to have neck discomfort or things like this. Like something has to be broken or something is going in a wrong direction for them to truly understand what you're saying. But I'm preaching to the our surgeons, but the conversion rate is very low
I
because
see. So
because
it's,
they just don't feel the need to change. So if that sense of need is not there, I just don't think that Gita is going to be very productive. But I'm so thankful that you have this podcast and talking about the importance of the ergonomics because this is such an important topic that we rarely ever talk about because even though you're just talking about the ergonomics, but this goes far beyond ergonomics, because when you have a musculoskeletal disease, because of the poor posture, not just in operating room, but if you have poor posture in the operating room, that means that you have poor posture in clinic, at home, while you're driving. It's a 24 hours a day. Even when you're sleeping, many of these people with poor ergonomics have poor ergonomics even with a sleep posture. And so all these things they have a cascade effect and impact their not professional life in terms of like wrong sight surgeries, fatigue, burnout, but also this will impact their social life, interpersonal skills too. Because a lot of times that this will, when you come home, you're not in a good mood. So now you're irritable to your wife, to your kids, or to your friends or significant other. And I think this truly has far-reaching impact than just ergonomics. So anyway, Kita, I just want to really congratulate you for having this podcast, and I support what you do 100%, truly 100%.
Well, thank you for your kind words.
Yeah.
I think our listeners at least are getting that message that, poor posture, poor ergonomics, it's not just about kind of our tasks in the OR. And like you said, there are far-reaching consequences, both for our professional as well as our personal lives. And that's why we're doing this, right? That's why we're trying to bring the latest technologies to people, start having these conversations, because traditionally we have not had these conversations. So, as you correctly pointed out, we are almost at the end of our time. And so I will say that it's been a pleasure having you here, and thank you for being here to share your very deep expertise when it comes to ergonomics and specifically as they relate to loupes. Please remember to subscribe to the podcast and follow us on social media: Instagram, X, Facebook, and LinkedIn. We love feedback, so please reach out to us for topics, ideas, speakers, or if you ever want to be a guest on the show. Thank you for listening. To enter your name for the Ergo Angle Deflection Loupes and Headlight Combo giveaway, please go to our podcast landing page at www.surgicalergonomics.com/podcast/ and fill out the contact form at the bottom of the page. Choose Other in the drop-down menu and indicate Loupes giveaway in the message. We will do a drawing for the winner in December of 2025, so please spread the word among your colleagues and friends who might be in the market for new loupes. Thank you.